In the 30 years that I have been both an orthopedic surgeon and an AMA member, our profession has seen the best and worst of times. One of the things that concerns me the most is that while many watching this believe in the AMA and think it is effective, most of the physicians in the country do not. We have strong, articulate leadership. That's not the problem. As I see it, the real challenge is that while AMA membership is up, 85% of the practicing physicians today are still not members. I think the AMA needs to be the go-to organization for all docs. That would allow its advocacy to have the impact of a tsunami breaking upon the shores of unreasonable regulation and administrative burdens. Hi, I'm Ronnie Dowling. I make my living seeing and treating patients every day, practicing general orthopedics in a small rural area of Arizona, 4 hours from anywhere. 30 years ago, I had a fierce desire to bring trauma care to regions which had none. As the first woman to complete an orthopedic residency in Colorado and the program's first female chief resident, I was well trained in trauma. The community hospital in Arizona was tiny, financially struggling, without an emergency room, an ICU, or even a C-arm. At night, a patient would actually ring the doorbell at the back of the hospital if ER care was needed. Most times, the floor nurse managed the problem. My husband is a general surgeon. Against all odds, we both stayed in the community, actively engaged in organized medicine. We changed the entire local healthcare system for a region 8 times larger than Rhode Island. This is one of the reasons I believe real change is possible. The connection between the AMA and the doc in the trenches needs to be reestablished. I have a hunger to do that, to keep the legislative wolves at bay, protect reasonable scope of practice limits, and help our patients live healthier lives. One of the shames of our healthcare system is that it is so much less than the sum of its parts. We are so much better than that. There are always great opportunities in times of difficult transitions. How great would it be if we embrace those opportunities and shape policies for the betterment of both physicians and patients? We all know healthcare is changing. Physicians need to be in charge of that change. I am ready to fight to make healthcare truly balanced and focus on policies which better the lives of patients while protecting our profession. I am focused, organized, and have years of procedural and speaker experience. I think the single most important thing we can collectively do is take the crazy out of the current system. I'm Ronnie Dowling. I'm running for Vice Speaker, and I would appreciate your support.